January 14, 1946. Somewhere in the British zone of occupation, Germany. ***. The winter light fell pale and gray through the shattered windows of what had once been a municipal hospital in Brunswick. Snow drifted through gaps in the masonry where Allied bombs had torn away entire sections of the building's eastern wing. In the makeshift operating theater, a German nurse named Margaret Hoffmann stood with her hands clasped before her, watching an American army surgeon prepare for a demonstration she had been told would change everything she thought she knew about medicine. Her uniform, patched, rewashed so many times the fabric had gone thin as parchment, hung loose on her frame. She had not eaten a full meal in 16 days. Around her, 24 other German medical staff stood in similar postures of exhaustion and barely contained desperation, their faces hollow, their eyes carrying that particular emptiness that comes not from a single trauma but from years of accumulated horror finally reaching its conclusion. The American doctor, Captain Thomas Whitmore of the 116th Medical Battalion, arranged his instruments on a cloth that seemed impossibly white in that dim room. Scalpels, retractors, sutures made of material the Germans had not seen in 3 years, sulfanilamide powder in quantities that made the watching nurse's breath catch, plasma, whole blood in refrigerated containers powered by portable generators that hummed with a sound that represented not just electricity but the vast industrial capacity of a nation that had never known strategic bombing, never known the systematic destruction of its infrastructure, never known what it meant to practice medicine in the ruins of civilization itself. When Whitmore began to speak, his words translated by a young Wehrmacht doctor who had learned English before the war, Margaret felt something crack inside her chest. Not her ribs, though those had been bruised when she'd been struck by a falling beam during an air raid in 1944. This was deeper. This was the sound of certainty breaking apart. "We'll begin," the American said, "with basic principles of aseptic technique." And that was when she understood that everything she had learned, everything she had practiced, everything she had believed about German medical superiority was about to be proven wrong. To understand why German nurses wept in the winter of 1946, one must first understand what they had been taught to believe. The German medical establishment had, for more than half a century, considered itself the pinnacle of scientific achievement. This was not mere propaganda. German physicians had pioneered pathology, bacteriology, and countless surgical techniques. Koch, Virchow, Ehrlich, these names represented genuine monuments of medical progress. German universities had drawn students from across the world. The language of medicine had been, in many ways, German. Young doctors from America and Britain had traveled to Berlin, to Munich, to Heidelberg to complete their training under masters who seemed to possess knowledge that bordered on the mystical. But something had calcified in that excellence. Something had grown rigid. The Nazi regime had not merely politicized medicine, it had militarized it, subordinated it to ideology, and most critically, isolated it from the rapid advances that had occurred in Allied nations during the war years. While German doctors had been pressed into service for the Wehrmacht, focused on battlefield trauma and increasingly desperate improvisation as supplies dwindled, Allied medical services had undergone a revolution. Penicillin, advanced plasma fractionation, rapid blood typing and transfusion techniques, systematic triage protocols developed across vast theaters of war, psychiatric interventions for combat stress, burn treatment advances. The entire infrastructure of military medicine had been reimagined, industrialized, and deployed at a scale the Germans, for all their vaunted efficiency, had never achieved. By 1946, the gap was enormous, and it was about to be revealed with the systematic thoroughness that only educators can deploy. The American medical teams that entered occupied Germany were not there primarily as conquerors, though conquest had certainly occurred. They were there because disease recognizes no political boundaries, because typhus and tuberculosis and dysentery do not respect armistice agreements, because the catastrophic breakdown of German civilian medical infrastructure represented a threat not just to Germans but to all of Europe. The occupation authorities understood this. If plague erupted in the ruins of Hamburg or the displaced persons camps near Munich, it would spread. Children were starving. Civilians were dying of preventable diseases. The German medical system, such as it remained, was operating with the supplies and knowledge of 1938, stretched across the devastation of 1946. So the Americans came not just with supplies, but with teaching. And the teaching was, in many ways, more devastating than the bombs had been. Margaret Hoffman had entered nursing in 1935, drawn by the same mixture of idealism and pragmatism that motivated young women across Germany. Nursing offered purpose, respect, technical training, and economic security in a nation still recovering from the humiliation of the Great War and the chaos of the Depression. She had learned her craft in the old style: rigid hierarchy, absolute deference to physicians, technique passed down through demonstration and repetition rather than explanation. There was pride in this. German precision. German thoroughness. The careful maintenance of instruments. The proper way to fold bandages. The exact angle at which to hold a basin for a surgeon. She had believed in this system. Even as the war ground on, even as supplies became scarce and improvisations became necessary, she had believed that German medicine remained fundamentally superior. The propaganda had told her this. The Strength Through Joy rallies had celebrated German scientific achievement. The newsreels had shown modern hospitals, efficient doctors, the triumph of Aryan medicine over the degenerate practices of lesser peoples. She had believed because belief was necessary, because without it there was only the chaos of a war that made less sense with each passing year. By 1944, she was working in a military hospital near the Eastern Front, dealing with casualties that arrived in numbers that beggared comprehension. Frostbite, gunshot wounds, shrapnel trauma, men with infections that turned their flesh black, with stumps that wouldn't heal, with eyes that stared at nothing even when they were technically still alive. She had learned to work without proper anesthesia, to reuse sutures, to make one morphine ampoule serve for 3 soldiers. She had learned to decide who might survive and who should be made comfortable in their dying, a calculus that ground away at her soul with each shift. She had believed they were losing because of numbers, because of the vast Russian hordes, because of betrayal and political failure. Not because German medicine itself might be inadequate. Never that. The Americans had disabused her of this notion in less than an hour. Captain Whitmore's first demonstration involved something so simple it seemed almost insulting: the proper washing of hands. He spent 20 minutes on this. The temperature of the water. The type of soap. The systematic scrubbing of each finger, the palms, the backs of the hands, the wrists. The time required, 3 full minutes. The use of a brush for the nails. The method of drying with sterile towels. The application of alcohol solution afterward. The German nurses watched in growing bewilderment. They knew about hand-washing. They had been washing their hands for years. But Whitmore was describing a protocol so thorough, so time-intensive, that it seemed almost neurotic. 3 minutes? In the middle of a surgical day? When patients were dying. Then he showed them the data. Infection rates in American field hospitals compared to German facilities. The numbers were compiled from captured medical records, from prisoner interviews, from the evidence of thousands of case files. German post-operative infection rates hovered between 30 and 40%, even in the early war years when supplies were still adequate. American rates, across multiple theaters, were consistently below 8%. In some specialized units, below 5%. The translator read these figures twice because several of the German staff appeared not to believe them. Margaret heard herself make a small sound, not quite a gasp, but close. These numbers represented death. If the Americans were correct, then hundreds, perhaps thousands of soldiers she had treated had died not from their wounds, but from infections that proper aseptic technique might have prevented. The weight of this settled on her shoulders like a physical thing. Whitmore continued. He demonstrated proper draping techniques, explaining the principle of creating a sterile field and maintaining it. The German nurses had been trained to drape patients, certainly, but the American method was different, more extensive, more systematic, with multiple redundant barriers. He showed them how to open sterile instrument packages without contaminating the contents, how to pass instruments to surgeons without breaking the field, how to monitor for potential contamination and respond immediately. Each technique was explained not through rote instruction but through principle. This was perhaps the most revolutionary aspect. The Germans had been trained to follow procedures. The Americans were being taught to understand the reasoning behind those procedures, to grasp the underlying microbiology, to become thinking practitioners rather than mere followers of protocol. Whitmore drew diagrams showing bacterial transmission routes. He explained Semmelweis and Lister, ironically, European pioneers whose insights had been more thoroughly implemented in America than in their homelands. He described the chain of infection and how each link could be broken. 2 hours into the demonstration, one of the older German nurses, a woman named Christina who had been practicing since before the war, began to cry. Not loudly. Just silent tears tracking down her face as she stood rigidly at attention, watching the American demonstrate a suturing technique that minimized tissue trauma and reduced infection risk. Whitmore paused, uncertain. The translator explained quietly that Christina had lost her son to post-operative infection in 1943, following what should have been a routine appendectomy. The American doctor nodded slowly. He said nothing about fault or blame. He simply continued the demonstration, his voice steady, his manner professional. But something had shifted in the room. The German medical staff were no longer watching a victor instruct the defeated. They were watching a colleague share knowledge that might prevent future deaths. The distinction mattered immensely. Over the following weeks, the demonstrations continued. Different American medical personnel rotated through the occupation zones, bringing their expertise to hospitals, clinics, and aid stations across the shattered landscape of what had been the Third Reich. They taught plasma administration techniques that the Germans had never mastered, having lacked both the industrial capacity to produce plasma in necessary quantities and the logistical systems to distribute it effectively. They demonstrated the use of penicillin, those miracle vials that represented, to the watching Germans, something beyond mere medicine. Penicillin was proof of American industrial capacity, yes. But it was also proof of something deeper, the value placed on individual human life. The Americans manufactured penicillin in quantities sufficient to treat civilians, to use it freely, to prioritize saving lives over husbanding scarce resources. In German military medicine, morphine had been rationed. Anesthesia had been conserved. Antibiotics, the few sulfa drugs available, had been reserved for those considered most valuable to the war effort. Young soldiers, officers, the necessary calculations of a nation fighting total war with diminishing resources. But the Americans used their supplies differently. They treated everyone, civilian and soldier, German and Allied. The apparent wastefulness of it was shocking. An entire vial of penicillin for a child's infected wound? Plasma for an elderly civilian? Anesthesia for dental work? Yet the outcomes spoke for themselves. Survival rates that the Germans found difficult to believe. Recovery times that seemed impossible. Rehabilitation of patients who would have been written off as permanently disabled under the German system. Margaret learned to administer penicillin injections following the American protocols. She learned proper technique for plasma transfusion. She learned to calculate dosages using American measurements, confusing at first, but logical once understood. She learned to chart patient progress using standardized forms that emphasized objective measurement over subjective impression. She learned to question, to suggest, to bring concerns directly to physicians rather than waiting for orders. This last was perhaps the most difficult adjustment. German medical hierarchy had been absolute. Nurses did not question doctors. But the Americans operated differently. They expected their nurses to think, to notice, to speak up when something seemed wrong. The first time Margaret pointed out a potential drug interaction to an American doctor, she braced for punishment. Instead, he thanked her, checked the medications, realized she was correct, and changed the prescription. Then he made a notation in the patient file crediting her intervention. She went to the supply closet afterward and wept for 15 minutes. The symbolic object of those months was not a weapon or a tool but something more prosaic, the chocolate bar. American soldiers carried them as field rations. The doctors kept them in their pockets and often shared them with patients or staff during long shifts. To Margaret and her colleagues, these chocolate bars represented something almost mystical. They were abundant. The Americans seemed to have an inexhaustible supply. They were freely given, not hoarded, not rationed, not reserved for the privileged. They were frivolous in the best possible way, representing calories devoted not to mere survival but to pleasure. German civilians and medical staff alike were surviving on approximately 1,200 calories per day in the British and American zones, often less in the French and Soviet sectors. Starvation was not dramatic. It was a slow grinding down of energy, of health, of the capacity to think clearly. Nurses worked 12-hour shifts on rations that would have been inadequate for sedentary office work. The Americans, by contrast, seemed impossibly healthy. Their rations were so generous that they could afford to give food away. Their cheeks were full. They had energy for jokes, for inefficiency, for the luxury of taking time to explain rather than simply command. The chocolate bars became a tangible representation of the fundamental difference between the two systems. Germany had mobilized every resource, extracted every possible calorie and ounce of material, driven itself to exhaustion in pursuit of total war. America had fought on multiple continents, supplied multiple allies, maintained a civilian economy that actually expanded during wartime, and still had enough surplus to produce candy bars for its soldiers. The disparity was almost incomprehensible. When Captain Whitmore offered Margaret a chocolate bar during a particularly long surgical session, she accepted it with trembling hands. She ate it slowly, savoring each small bite, and felt something fundamental shift in her understanding of the world. This was not about German inferiority or American superiority in some racial or cultural sense. This was about systems. About choices, about what a society prioritized and how it organized itself. The Americans had built a system that valued abundance, that sought to lift up rather than perfect through elimination, that accepted inefficiency if it meant preserving individual dignity and life. She had been taught that such a system was weak, that only ruthless discipline and sacrifice could build true strength. But here was the evidence before her. The ruthless system had collapsed into ruin. The inefficient, abundant, apparently soft American system had not merely survived but thrived. It had produced enough wealth to fight a global war and still maintain living standards at home. It had generated sufficient industrial capacity to outproduce all its enemies combined. It had preserved enough cultural vitality to attract defectors and inspire loyalty among occupied populations. The chocolate bar dissolved on her tongue, impossibly sweet, and Margaret understood that she had spent 12 years believing a lie. The transformation in German medical staff was not uniform or immediate. Some, particularly older physicians trained in the imperial era, resisted the American methods. They saw adaptation as admission of defeat, as betrayal of German traditions. Some withdrew into bitter silence. Others argued that German techniques were being unfairly maligned, that the comparison was invalid because Americans had never faced the resource constraints Germany had endured under blockade and strategic bombing. There was truth in this. The Americans had indeed benefited from industrial abundance that geography and circumstance had preserved. But the demonstrations were not merely about resources. They were about methodology, about systematic thinking, about the willingness to question and revise rather than cling to established practice. The Americans brought not just supplies but a fundamentally different epistemology, a way of knowing that emphasized empirical testing, statistical analysis, peer review, and constant improvement. German medicine had been brilliant but had calcified around the achievements of previous generations. The Americans were less reverent toward tradition, more willing to discard what didn't work, more pragmatic in adopting techniques from any source if they proved effective. They had incorporated British advances in plastic surgery, French developments in neurology, even Soviet innovations in trauma treatment. They were intellectually promiscuous in a way that German academic culture, with its rigid hierarchies and its emphasis on lineage and schools of thought, had never permitted. The younger German medical personnel adapted more readily. They had less invested in the old system, less pride to swallow. They had seen too much failure to cling to myth. When an American nurse taught them a better way to dress burns, they learned it. When an American surgeon demonstrated a vascular repair technique that reduced amputation rates, they absorbed it. They were hungry, not just for food, though that too, but for hope. For the possibility that medicine could be something other than triage and managed dying. That they might save rather than merely sort. By spring of 1946, the German medical staff in American and British zones were being systematically retrained. Field manuals were translated into German. Demonstration surgeries were performed in major hospitals with German observers invited. Supply chains were established to ensure German facilities received adequate materials. The process was imperfect. There were cultural clashes, logistical failures, instances of arrogance on both sides. But it continued. And the infection rates began to drop. Patient outcomes began to improve. The data, compiled month by month, showed undeniable progress. Margaret kept a small notebook during this period, recording what she learned. The entries were terse, technical, but between the lines one could read the story of a worldview being reconstructed. Today learned proper tourniquet placement, had been doing it wrong for years. American method for chest tube insertion reduces pneumothorax risk by estimated 40%. Was taught to question surgeon if order seems incorrect, still feels wrong but they insist this is proper protocol. In June, she assisted in a surgery that would have been impossible 6 months earlier. A young girl, perhaps 8 years old, with a badly infected leg wound that had been neglected for weeks. Before, amputation would have been automatic. Infection would have spread, sepsis would have developed, death would have followed. Instead, they administered penicillin, performed debridement using the new techniques, applied proper dressings, and monitored carefully. 3 weeks later, the child walked out of the hospital on 2 legs. Margaret went home that evening and cried for an hour. Not from despair this time, but from a grief so complicated she could barely name it. Grief for all those who had died when this was possible. Grief for the lost years. Grief for her own complicity in a system that had wasted lives through ignorance and ideology. And beneath the grief, something else. A fragile, tentative hope that perhaps she might yet do something meaningful with the years remaining. The American doctors and nurses who conducted these training sessions were themselves changed by the experience. They had expected to find a defeated enemy, and they had. But they had also found colleagues. They had expected primitive conditions, and they had found sophistication corrupted by circumstance. They had expected resistance, and had instead encountered desperate hunger for knowledge. Many of the Americans wrote letters home describing the experience. Captain Whitmore, in a letter to his wife dated March 23, 1946, wrote, "You cannot imagine what it is like to teach someone who watches your every move as though you are performing miracles. These German nurses are not stupid, far from it. They are skilled, dedicated, and in many cases more experienced with trauma than I am. But they have been working in the dark, making do with nothing, and watching people die who didn't need to die. When we show them a better way, they absorb it like water into sand. There is something both inspiring and heartbreaking about their gratitude." Lieutenant Ann Morrison, a surgical nurse from Boston, recorded in her diary, "Today one of the German nurses, Margaret, I think her name is, asked me why we were helping them. Why we would take the time to teach the enemy. I didn't know what to say at first. Then I told her that we weren't healing Germans or Americans. We were just healing people. She looked at me like I'd said something profound, but it's just the truth, isn't it? Medicine is medicine. Suffering is suffering. We know how to reduce it, so we should. It's not more complicated than that." But it was more complicated than that, of course. There were political dimensions, strategic calculations, broader questions of how to rebuild a shattered continent and prevent the rise of the extremism that had led to this catastrophe. The Americans were not naive. They knew that competent medical infrastructure was essential to stable occupation. They knew that teaching German medical personnel properly reduced disease risk to Allied troops. They knew that demonstrating American competence and generosity served propaganda purposes. Yet the individual interactions transcended these calculations. In the operating theater, in the ward, at the bedside, politics receded and what remained was the basic human impulse to reduce suffering. The Germans learned American techniques. The Americans learned German thoroughness. Friendships formed, cautious at first, but gradually more genuine. There were shared cigarettes during breaks, conversations about families, the careful building of trust between people who months before had been trying to kill each other. This was not reconciliation exactly. The crimes of the Nazi regime could not be erased by shared medical practice. The nurses who wept while learning new techniques did not thereby absolve themselves or their nation of collective guilt. But it was a beginning. A recognition of common humanity. A rebuilding not just of medical infrastructure but of the possibility that different peoples might work together toward shared goals. By autumn of 1946, German medical facilities in the western zones were operating at something approaching pre-war capacity, though supplies remained scarce. The systematic retraining had reached thousands of medical personnel. Standardized protocols based on American and British models had been implemented. Infection rates across military and civilian hospitals had dropped to levels comparable with Allied facilities. Maternal mortality had declined. Childhood disease fatality rates had decreased. The typhus epidemic that had been feared had been contained through systematic vaccination campaigns conducted by retrained German staff under Allied supervision. The transformation was not complete. Germany would struggle with medical resource shortages well into the 1950s. But the foundation had been laid. More importantly, the intellectual framework had been transmitted. German medical schools, when they reopened, incorporated the new methods. The next generation of German physicians would be trained in techniques that emphasized evidence over tradition, outcomes over theory, systematic improvement over rigid adherence to established practice. Margaret Hoffmann continued working as a nurse through the occupation period and into the economic recovery. She eventually became a nursing instructor herself, teaching younger colleagues the methods she had learned from the Americans. In her classes, she was known for her insistence on proper aseptic technique, for her emphasis on empirical observation, and for her habit of telling students that pride was the enemy of good medicine. "If you think you know everything," she would say, "you have stopped learning. And if you have stopped learning, people will die." She kept the wrapper from that first chocolate bar Captain Whitmore had given her, pressed flat in the notebook where she had recorded her lessons. When students asked her about it, as they inevitably did, she would tell them that it represented a time when she had learned that being defeated in war was less painful than being victorious in ignorance. That true strength came not from never falling, but from getting up and admitting you had been wrong. That chocolate, of all things, had taught her more about freedom than 1,000 political speeches ever could. The story of German nurses weeping while learning American medical techniques is not a story about the superiority of one nation over another. It is a story about the price of isolation, the danger of ideological certainty, and the possibility of transformation through humility. The German medical establishment in 1945 was not incompetent. It was the product of a system that had subordinated human life to political goals, that had valued racial purity over scientific truth, that had isolated itself from international collaboration and thereby cut itself off from the rapid advances that collaboration enables. The Americans who taught them were not saints. They represented a nation with its own deep flaws, its own history of racial oppression, its own capacity for violence. But in that specific moment, in that particular context, they carried knowledge that could save lives, and they shared it. They could have hoarded it. They could have kept their techniques secret, maintained their advantage, allowed German medical inadequacy to persist as a form of continued punishment. Instead, they taught. This choice reflected something fundamental about the American system, something that transcended individual virtue or vice. It was rooted in an abundance mindset rather than a scarcity mindset. The Americans believed, with a faith so deep it was almost unconscious, that there was enough. Enough food, enough knowledge, enough prosperity. That lifting others up did not require pulling yourself down. That sharing did not mean losing. This was the ideology of the chocolate bar, freely given. This was the practical manifestation of democratic ideals that in political discourse could sound empty, but in material reality meant that a nurse who had served the enemy could receive the same training, the same respect, the same patient care protocols as an American citizen. The tears shed by German nurses in 1946 were tears of grief and release. Grief for the years of unnecessary suffering. Grief for the lies they had believed. Grief for the complicity those lies had enabled. And release from the burden of maintaining those lies. Release into the possibility that the future might be different from the past. That one could learn, change, grow. That defeat in war might lead to victory in peace if one had the courage to accept instruction from those one had been taught to despise. In the cold January light of 1946, Margaret Hoffman had watched an American doctor demonstrate the proper washing of hands and felt her world crack apart. In the months that followed, she rebuilt that world on a different foundation. Not on certainty, but on questioning. Not on tradition, but on evidence. Not on pride, but on the humility to admit ignorance and the courage to overcome it. The chocolate bar wrapper in her notebook was a talisman against forgetting. A reminder that freedom tastes sweet not because it is easy, but because it is generous. That democracy is not merely a political system, but a stance toward knowledge itself, the recognition that truth emerges from argument and testing rather than from authority and decree. That abundance is not just material but intellectual and spiritual, a willingness to share rather than hoard, to teach rather than dominate, to lift rather than push down. When she died in 1978, that notebook was found among her effects. Her children, going through her belongings, puzzled over the chocolate wrapper pressed between pages of technical medical notes. They asked each other what it meant. Eventually, her daughter, herself a physician, understood. She kept the notebook, and years later donated it to a medical history archive where it remains today, a small artifact of a transformative moment. The German nurses who wept in 1946 were not weak. They were strong enough to acknowledge they had been wrong, strong enough to learn from those they had been taught to consider inferior, strong enough to change. In a century defined by ideology, by rigid certainty, by the willingness to sacrifice millions to abstract principles, their tears represented something revolutionary. The acknowledgement that human life matters more than national pride, that competence matters more than tradition, that the truth, painful as it may be, must be faced if healing is to begin. They learned. They taught what they had learned to others. And in teaching, they became part of the great work of reconstructing not just Germany, but the very possibility of a world where medicine serves life rather than ideology, where knowledge flows across borders rather than being trapped behind them, where a chocolate bar freely given can mean more than 100 martial anthems, where the tears of humiliation can water the seeds of transformation, and where the defeated can, through learning, become victors after all, not over others, but over their own ignorance, their own certainty, their own pride. This is the larger truth, that civilization is built not through dominance but through the generous sharing of what we know. That the measure of a society is not its capacity for violence but its willingness to teach even its enemies. That the abundance which matters most is not material but moral, the abundance of spirit that can extend a hand across the chasm of recent war and say, simply, let me show you a better way. And in showing, in learning, in the humble exchange of knowledge that flowed from American doctors to German nurses in the ruins of 1946, a new world was born. Not perfect, not without pain, but possible. And that possibility, fragile as it was, profound as it remains, was worth every tear.